Welcome, welcome. I just want to make sure we're live already. Welcome to the Clear Vision Wednesday show with your host. That's me. I'm Claudia Mühlenweg, and I am the creator of the Natural Clear Vision Method and the founder of the Natural Clear Vision Institute. And every week we bring you amazing topics, everything related to natural vision improvement. And today's topic is a must-watch for anyone that is a parent. In other words, you have children, or maybe you have grandchildren, so for grandparents, but even for everybody else, because your inner child has also something to say about your vision. And maybe you got glasses in childhood. So definitely, even if you don't have children, listen in and watch this discussion with my dear friend and colleague, Anat Axelrode. I will bring her on stage right now. Welcome to the show, Anat.
Thank you, Claudia. Thank you so much.
So you are, okay, so I'm sorry, I didn't want to cut you off. Go ahead.
Yeah, I'm so happy to be here again. And I want to thank you for doing this Wednesday show. And it's like a treasure of so many valuable things that you bring to the world. And I just want to thank you so much for this.
So I always like to ask about your story, but I know you had glasses at age 6 and then you got rid of them. So you are a Bates method practitioner, but you also have your own methodology called listening to the eyes, which I absolutely love. I took a super basic level program with you as a teacher, and it's so incredibly powerful. And you've trained over 70 other teachers. You've also, I'm looking at my notes here, you are a miraculous parenting facilitator. I actually got the book. It's a fascinating book. Haven't finished it yet. And you also are trained in the emotional freedom technique and in nonviolent communication. So our topic today is really important. It's how parents affect our behavior, however we want to say it, affect their child's vision, right? And I want to say something else, because I went through a terrible divorce when my children were young, and I sent them to counseling, and then the counselor would always say at some point, "How are you doing?" I'm like, I'm okay. But I also didn't really, I did my best, right? We all do as parents, we all do our best. And it's very, I got defensive very easily because I was a single mom, 2 kids, full-time job, basically get no sleep. And then somebody comes with giving you suggestions and things and you're like, God, I can't do anymore. So I want all the parents here to just listen with curiosity and compassion for yourself, because I think speaking as a parent, without knowing what you're all going to tell us or not, but I just remember that I felt very defensive a lot of times when people gave me advice, because I was so kind of exhausted already. So anyway, with that said, tell us a little bit about this topic and what you're going to cover today.
Well, first, I want to confess, I don't have children, but I really, really love to work with parents, and I do it quite a lot for many years. And I'm going to speak today about what behaviors in the family you as a parent can do or not do in order to affect your children's vision, and how much simple things that we can just realize and change in the family can do a huge change in our children's lives and vision.
Okay, it's fascinating. So obviously, we have an epidemic of myopia, of nearsightedness in the world, all over the world. It's really bad in Southeast Asia, but it's rising everywhere, and not just since COVID happened and we had Zoom school. So maybe we should start. Does that make sense? Or not? Should we start? Okay. So let's look at nearsightedness, and then we're going to cover other vision conditions that children commonly are diagnosed with. So what is the connection between the family, the parents' behavior, the dynamics in the family, and the development of nearsightedness?
Yeah, so let me start saying that I can give a headline for this topic, and it is closeness, relationship of heart which is open and not closed to ourselves and to the people in our home, to our family nest. It's like when we are more open, when we are more close, things are mostly related to myopia can be changed. And let me start by, there are a few characteristics of myopia regarding the emotional state of the child. But, you know, when we, as a Bates teacher, we said to the parents, be more outside, take your children outside, look far away, be in the sun. You can do palming together, or many things out, palming or outside things are really, really important, and it is really important. But sometimes we can do all of this, but the most effective thing that we can do in our relationship in the family, we don't see it. It's like it's a blind spot. And I will start with one thing regarding myopia, which I just realized in the last year. I didn't know it. I'm working in this field more than 21 years. And only the last year, I realized something about eating together family meals, like family dinner or lunch. It's regarding your environment and how you do it. And I asked many myopic people, adult people, about it. And high myopic, many of them, they miss this feeling of togetherness in the family. Like we are together, we are like, we like one body. Mom, dad, and the children, or the parents and the children, we like together. And when child have this sense of we are together, this small family, we are together in the world. He have safety sense in the world. I'm safe because my love and my surrounding is safe. So I give you an amazing story. I had this family came to me a few years ago, mom and dad and two girls. One of them have myopia, like started just in the last few months. So they came to me and I asked many questions in the first meeting. I gave a few things to do. Well, they came after 1 or 2 weeks. And I said, okay, what did you do? And they said, we didn't do anything. We didn't have time. It was there. We didn't do everything you said we didn't do. Okay. But the vision of the girl is much, much better. Like she's improved dramatically, her vision. And I said, so what has changed? What did you do differently? Because something different, obviously something changed. Her vision is much better. And the child said, I see much better. What did you do? Well, they said, well, actually, we just changed something in school because till last week, she used to stay at school till, I don't know, 1 o'clock noon, and then stay a few more hours in a special thing that they have after school. And then from there, she's going to gymnastics. Can you hear me? I'm just a little bit.
Yeah. So basically after school care, okay, so what did they change?
So they changed, the parent thought, well, it's not make any logical, financially, it's cost us too much to keep the girl at school for those hours before the gymnastics. So let's cancel this thing. So the girls, instead of staying at school, came home, sit together to eat lunch with the parents, rest a little bit, and then after 1 hour, 2 hours, go to gymnastics. So suddenly every day they are eating together, they are sitting together every day. And their myopia improved dramatically.
That is so interesting. I mean, I didn't work a whole lot with children, but I did when I had my one-on-one practice in person. And what I found in all the cases of myopia, and tell me what you experience, is exactly the opposite. There's huge discord in the family. A lot of times, let's say one parent was really in favor of natural vision improvement. The other parent was like, no, put your glasses on. And the poor child was kind of torn between them. Or they were high achievers. They were like super intelligent children. And so there was a lot of pressure, or they hated the school. They really didn't like the school. And I understand, again, I was a parent, a single parent. So I could not have taken my kids to lunch or brought them home because I was working somewhere. So I had to, but I had a nanny who took them home, and then they ate at home together. So that's a good thing. But my point is like, go ahead.
Sorry, but even overachiever children, not always the parents are saying you need to be better. Sometimes I have now a child, she already finished, but she a young teenage. She came to me, and with myopia that is going high really fast. Every 6 months she needs new glasses. And when she came, and she also very anxiety before test, and she's really stressed. And the parents said, I don't know, like we don't say anything to her, like she can bring us a D. We don't care. But actually underneath, it's not really true that they will be okay. This is first thing. The second thing, that I work mainly with the father. And the father is a person that is only can accept good vibe conversation. If you feel good, I'm with you. If you say not in. If you're angry, I'm not in. Like, all the relationship is only about good things. He said, I have many friends. We talked about only good things. I said, but sometimes bad things happen. No, we don't speak about it. So every time this girl is feeling not great, you are not an ally for her. You abandon her. She's alone. She don't have you. And in myopic children, the relationship, mostly with the father, actually, usually with the father, is extremely important. And when there is no closeness and there is no heart open with the father, the child sometimes don't feel safe enough in the world. And this is something that causes myopia. So this father, I asked him, do you want to bring more closeness to your life? Do you want to learn how to contain sadness and other things than joy, and not to be like? And he said yes. And he was able to make some change, not big change, but some change. And the vision of the child started to improve, of course, with another thing, but she started to improve. So after a few months, it's improved a little bit. She gets lower prescription, the deterioration stopped, she got improved. After a few months, she came to me. Again, I see terrible, and my anxiety is back. And then I asked, what happened in the family? What is going on? And they said, yes, recently we are not spending time together, all the family. We just went a little bit apart. Each one is in own business. And I said, okay, so start to do more things together. I said to the father, you are a very meaningful person in this family. Don't think you are just some tool to do things, wash dishes, take the children. No. It was very important for him to hear that he's very meaningful, and they need him, his personality, his presence. And they start to do things together, and their vision immediately improve again.
That is so fascinating.
The anxiety went down again.
I for my own work, it's like, it's very interesting because, like I said, as parents, it's almost like I wanted to work with the parents first, and as a parent, it's interesting too, because I've noticed, like, we would do anything to have our children be healthy and happy. And a lot of times, and all the examples that you described, it's really, we need to work on ourselves to really support the child. And I think that's probably for everybody listening here, the most challenging thing is that it's almost about our own behavior. I have to look at ourselves, how close, all the things you talk about. These are great examples. I absolutely love this. So myopia is really about closeness, having those things, whatever that could be. Like, if, like me, if you're a single mom or single, like whatever that can be, really spending time together. And giving the child the sensation they're safe. I hear you, no matter how bad you feel. And I remember particularly as a mom of two girls that when the teenage years come, it's like, you know, all you hear is like doors are shut and like leave me alone and you're stupid or whatever horrible words I'm not going to say here. And at that point, it became for me, and I don't know if you have an answer to that, but it became very challenging to kind of still get that closeness, you know, like because at some point you're like, I'm doing all these things for you. You don't even clean up your, like, you don't even do the basic, you know, things. So you don't do anything in the house. You just, and it's just, it was, I mean, we had literally arguments, you know, so I'm totally fessing up. It was challenging and I had to get my own counseling, but it's, anyway, if, I don't know if you have an answer to that in terms of, especially teenagers, you know.
Because many parents are trying to change the behavior in order to change the situation at home.
True.
But the change won't come from the behavior. The change will come from not what to do, but who to be.
That's so powerful.
Who to be, because if I want a relationship of closeness in my home, so I need first to do it with myself. I need to find it inside me. You know, this week, a woman came to me and she said about her daughter. Her daughter is 20 something. And she said, she's not this and she's not good. And she's, I said, but of course she's hate you. Sorry, yeah, but of course she's, and she don't talk to me. I said, but of course she don't talk to you. You see only the bad thing about her. Now I give you an exercise. Don't say anything of criticism, and just look for good things to say about her. I love your shoes. Thank you for taking me to this appointment. I like what you did with your hair. Just took a magnifying glasses and look for good things to comment. And if you do that, immediately there will be more closeness, and stop saying the criticism, because she expects the child to understand that she loves her, but she don't say anything of love. She feels the love for her child, but what she's saying is the opposite.
Honestly, it sounds like exactly what my mother does. I'm still trying to get love and it's all I hear is criticism. So I don't want to blame her, but it's like, I'm totally beyond that in a way, but it's definitely true. I can resonate to that. And also being a mom or having been a mom of small, now we have a great relationship, but there were definitely years where it was challenging. So before we move on to like farsightedness and squint or strabismus cross-eyedness, which is also very common in children, I'm just curious about one more thing. So when you said the father is really important, and I don't know if that applies to everybody or just myopia. So do you find that the vision of the father has an impact? Like if the father is farsighted or nearsighted or perfect? No, that has, okay.
Of course it has effect. But if the father is feeling, for example, distance from the child, one father told me one time, I asked him, how is your relationship with this child? And he said, you know what, I have 5 children, and with this child, I feel a little bit distance. And this child had myopia. So the relationship with the father is usually extremely important. And this father can be really great father. But if sometimes is open-hearted and sometimes not really. If he's not, we cannot know what to expect. When I look at him, I don't sure if we'll be loving or not. Make fun of me or love me. I had one father that had a trauma. He lost his very best friend. And since then, every time his heart started to open, it was just shut down. Eyes was turned off. And his young child, she got really high myopia because she didn't know when my father is full of love and when he's close his windows, you know. And it was like work with him about willing to be exposed and weak in front of your child and in front of your family. and willing to mourn about your friend. It was really meaningful work with him. So we need to first, if you are a parent and you want close relationship, it's not, the first thing is not to say to your child, let's do a close relationship. You first need to feel it within you and know that you need to go through something within you need to get close to itself. And you need to be willing to meet things in yourself that are not necessarily easy. But then you get intimate relationship with yourself, and then it will affect the intimate relationship that you have in life.
I love that. So we covered myopia, and last question about myopia. So the mom is obviously not unimportant because they can also be open-hearted and close-hearted, but you felt the father, or from your experience, the father has the bigger impact in this case. Okay. And
that's
I
what
love
I see. That's
right,
that's my experience. And in hyperopia, in farsightedness, the mother have more impact.
Oh, interesting. So let's switch to that topic. And so wrapping it up, like a simple thing is like dinners together, lunches together. That's the easier thing to implement than, when you work on yourself, you have to really, like you said, connect with yourself. But something simple, just spending more time together can already make an impact. I totally love that story. So let's switch to
and see how we can
right
be more together as a one cell.
So more together for the myopia. Now let's switch to farsightedness and what's some people call it a cross-eyed commonly, right? But it's strabismus or squint but some kind of alignment problem with the eyes.
So just one word about hyperopia, farsightedness, because it's not so common, but usually it's really more about the mother feeling safe in her life, and many times feeling safe with the father love. So I'm as the mother, am I feeling safe? Not safe like am I feeling safe with the love of my partner?
What about a single mom? Nowadays, we haven't really talked about divorce and separation, which I went through, and it's in itself a whole challenge.
Let's talk about divorce and separation, because this is really related to strabismus or cross-eyed or squint, whatever you call it, when one eye is inside or outside, or maybe two eyes are. So in strabismus, you have, well, there is not like one thing that I can say about it. Well, if there is something happen, like the child, like a baby hits his head or something, so it can cause strabismus, and there are many reasons. But if there is no other reason that is shown, many times it's emotional thing. So if there is divorce, especially difficult divorce, it can cause the one of the children to be with cross-eye, because it's like the parents are pulling to two different directions, and so the eye is going to two different directions. Actually, it can be also inward, but I had this family that came to me. It was a few years ago. The child then was 1 year old. Now he's 4 years old. And when they came to me, actually they were already separated. They separated before he was born. A few weeks before he was born, there was a betrayal, and it was really hard separation. So he was born into this very painful, full of hatred and anger and pain situation. And so when they came to me, I just worked with them, mostly separately, because they can't work together. They can't be together. They don't.
It's amazing they came together. It sounds like they came together. That is alone is a miracle, actually.
Well, on Zoom, yeah.
Oh, on Zoom, okay, yeah.
And they live in the same community.
Okay.
It's not easy at all. And so they learned, both of them, to accept. They didn't want to get back together. but they learn to be more relaxed in the situation and to accept that this is the situation. And so when this happened, the eyes of the child went straight.
Wow.
I mean, the doctor said he needed the operation, but when they got in peace they got more, their hearts start to open a little bit towards oneself, and the eyes of the child got straight. And then 1 year later, they told me again, it's called back. Again, there is a little bit squint, cross-eyed. And I said, what happened? And then the mother said, I feel a little bit, the father had a girlfriend. And this make a lot of pain to the mother because they are in the same community. It was really painful. And so I work with the mother of getting stronger in herself and not being dependent on what have been, and just be more in center with herself. And again, the eye got straight.
And here's the fascinating thing. You didn't really do any, what people think, exercise with a child, right?
He was too young.
Yeah. I mean,
he didn't do anything. Yeah.
But they always recommend surgeries. And I think this is a very important message that you are sharing here. There could be physical trauma, but the surgery just straightens the eye, but it doesn't address any of those root causes. And so the eyes will always turn back in or go back out. It's a very traumatic experience for a child to get eye surgery. So I think it's very important that parents or anybody listens to this and really talks about that. And also, even if you would at least do vision therapy, at least that, could be also additional helpful with the eyes to be aligned, but the surgery. So this is very interesting. So do you have another example of strabismus? So like cross-eyed, wall-eyed example?
I have amazing story, which is in my book. It's in my book, which will soon be published in English in a few months.
Yes, awesome. I can't wait.
In a few months in Amazon.
Right. So tell us about this other story. I would love to hear that.
So in my book, there are stories of conversation with the eyes, but there is few stories about children like that. And so I had this child came to me. She was about 12, and she had really severe cross-eye, and almost all the time pain in her eyes, in her head. Like from the eyes, there was all constant pain. And she came to me for a few months with her parents. They were really dedicated. Every, I think, second week, they came together. First, the child went in for half an hour, and they wait outside. And I speak with her about what is bothering her and what is going on in her world. And she was really, she was really efforting to be a good student, and she had no friends in school. She had really hard time. And then the parents went in and she out. And I talked with the parents about what I think they need to change in themselves in order to help the girl. The mother, in this few months process, had very, how I say, I'm sorry, just slow but constant change. And she came to be more kind to herself. And she was, she learned how to respect her space and not to work when she's sick. And she was really, really becoming really more worthy and more respecting herself. And it was beautiful. And the father, it was like, he wanted to change. He understood that he needed to change because his vision of how children need to be was really, they were from Russia and they were really strict people. But nothing changed with the father. And it went on for months that I did something with them. And then one day, the parents came, only the parents without the girl. And father eyes were like brighting, like glowing, like this. And he said, I understand that I am worthy, that I am enough, that I don't need to make an effort in order to be worthy. He just listened, he heard something in some lecture, and suddenly it clicked to him.
Yeah.
And he was like, I'm okay as I am. I don't need to make an effort. The next meeting, the child came, her cross-eyed is much less, and there is no pain. After many
Wow.
years of pain, it just got so much better. And she said, everything is great. I have friends in school. Everything is great. I'm so happy. Suddenly, it was like different child. It was different child. And 1 week later, they came to me, all the family. We decided to go to trip around the world for 1 year, to drop our jobs, our career, to take the children out of school and just have fun around the world. The change was so dramatically, and it immediately affected the child, the girl eyes.
Wow, I mean that is just. I mean, I love your stories because I think the stories tell. I mean, stories always tell is the best way to explain all this. So, I'm looking at the time. I want to cover also like lazy eye. So a lot of times, people come to me and they have lazy eye or amblyopia, what's officially called, since childhood, where one eye is kind of suppressed, usually due to double vision, and then one eye gets suppressed. So is there also a parental behavioral thing that is related to that? Okay, of course it is.
Yes. And, where, of course, the term lazy eyes is terrible term
I know,
because
I know,
we
it's
all know
horrible.
that, yes, but we said amblyopia, but no, sorry, but usually people don't know this term.
Same
But
with strabismus. People don't know what strabismus is, and when I say cross-eyed, but then strabismus can also be not cross-eyed, but yeah. So
yeah,
everybody
so
like myopia, not lazy eye, because the poor eye is definitely not lazy. So
yeah, so amblyopia is when there is no accident or something, when one eye is dramatically see less well than the other, let's say. Usually she's not lazy, usually she's stressed eye. But in intern terms, it's like there is some part in me that I have to shut down. There is something in me that is not allowed to be. So, for example, if I was born in a family that there is only one person that is allowed to be powerful, let's say my mother. Only my mother can be powerful in the family. My father is weak. We all have to be weak. Otherwise, we won't survive in this family. So this is the child vision, how you see the world without even knowing that is his family. So if I am a powerful human being born to this family and I need to survive here, I need to shut down my power. And this can be affected, it can be seen as a lazy eye. Or the opposite, I'm very sensitive child in very non-sensitive family. I need to shut down my sensitivity. So lazy eye, I came to see that lazy eye or amblyopia there is part of me that is not, it cannot exist in order for me to survive. To survive, it means in order to me to be loved in this family, to be accepted in this family. And I have a story, it's not exactly amblyopia, but it's kind of, I explain that. It's also in my book, actually. So family came to me, the child was 3 years old. Since she was a year and a half, she had almost always inflammation in the eye. Red eye, swollen. They try everything, all the natural medicine, all kinds of therapists. They went to all the doctors, they get steroids, they get antibiotics, they get everything. Nothing helps. 1.5 years, they're going from person to person and try to understand how to help this poor child. Her eyes is almost closed. the doctor said it's already amblyopic eye, because almost not already, but it will be. If it won't change, it will be.
Right.
And the cornea is so damaged that there is really big scar on the cornea. And so as we work together, we discover that actually the mother, which is great, loving mother, yeah, since this child was born, she cannot stand this child. This child is too much. She too much crying. And she too much laughing. And this inflammation is too much. It's like, that's what her mother, when we dig in, that's what the mother experience. She's too much. And when we dig deeper, we discover that the mother had the same experience in her life with her mother. I was always too much crying, too much laughing. Till now, till this day, I feel that I'm too much. And her husband tell her, you're not too much for me, even when you're crying, even when you're laughing. And she learned to accept herself. And this part of her that is so expressive. She cried loud, she laughed loud. She's so like this. And she learned to love this part in her. And then she started to accept this part in her daughter. The inflammation disappeared completely. I know them for many years now. It didn't gain back. They did so deep healing that it just healed the eye.
That is, it all makes so much sense, right? But it's so interesting. I have so what about, we have a question on YouTube I want to check in with, but let's get, like, what about astigmatism, which I feel is not as common, but I recently had parents reaching out to me, and their child, very young, I can't remember now, like just a few, maybe 2-3 years, already has a -5 or 6 level of astigmatism, like super high. Do you have anything about that? Any kind of experiences with that?
I would say short thing. I won't get into it much, but well, many times I see that in astigmatism, the father view on the world and the mother view on the world are very, very different. But I came from 2 different stars. And it's like the child have this thing from one side, but not from the other side. It's like I have half of it. It's like some do and some don't. I have it in some way, but not in the other way.
Okay,
So,
that makes sense. But do you see that with divorce? Maybe, a couple might be totally on the same page, and then they're divorcing and maybe have new partners. So have you noticed any development of astigmatism connected to a separation, or where the parents suddenly are not on the same page and they might have very opposing views? Or
no, I didn't notice that. Maybe I will. But
yeah, well, all more things coming up now. It's also our own attention as a teacher, that you're more tuned into this. So we have a question on YouTube. I think it's interesting. Sun Moon writes, I had strabismus as a child and my parents didn't ever divorce. What if you're upset that your father doesn't do much to step up for your mom, or to your mom, I guess, in helping out, or for your mom in helping out? It's unfair. So basically, dad is like the lazy bum, what I'm hearing here from Sun Moon, and mom is doing all the work in the house, and there's a kind of a feeling for her, like, I feel this is really not fair.
yeah, it can be that I'm taking one side. I'm taking the side of one parent's. I'm stepping in with my mother and with my father. I'm angry about one of them. Of course, this can affect.
But you also talked about this. I think you did talk about strabismus, hyperopia, where it's more related to the mom not feeling loved and supported, right? You said that earlier, if I remember. There's a connection to the mom is not feeling powerful. And is that true? Because that would make total sense then, that example.
Yeah, in hyperopia, yeah.
Yeah.
Many times the mom don't feel safe with the father love or with her partner love. And hyperopia can cause also cross eyes that inside. Yeah, the eyes are going inside.
So I have a personal question because I was born with a squint in my right eye going in, and I got my first pair of glasses at the age of 3, hyperopia, all this kind of stuff. It's I don't remember because I was so little. I just remember when I got my glasses and then got into school, I remember all that stuff being very traumatic and stressful for me. But I always was closer to my dad. And I, so I need to talk, I need to have a session with you because now I'm more curious into how, was that, because I think when you look at baby photos from me, like I was as a baby already, right? The old pictures in black and white, you can already see my right eye going in to the nose. And so this was definitely something that I was born with. So I think whatever happened maybe before I was born.
Sometimes you can know what happened by speaking with the eyes, what I do with adults.
Oh, yes.
Conversation with the eyes. So conversation with the eyes is what we talked about in our last conversation. So
channel, everybody, like that's on the channel already. We did a whole discussion where we guided everybody through a meditation. So if you want to do that, then look on my YouTube channel for Anat and you will find that episode, which was amazing. Okay, I will do that.
Yeah, so you need to speak with your eyes and maybe you will know. But I want to say something maybe that is very important for me to say, that is something general about every condition of the eyes. That the first thing I ask parents that come to me, I ask them, how do you feel about your child having myopia, about your child needed glasses, about your child suddenly have cross-eye? How do you feel about it? This is so important because if I feel afraid, if I feel anxious about my child need glasses, I'm not helping him. I'm doing the opposite.
Mm-hmm.
Parents cannot help child with fear. It's the opposite. It's stuck the problem. I had this parents that it's a story that didn't end well. Yeah.
Okay, tell us that story. Okay, yes, go ahead.
8 years old child. He had some accident and he got a hit in the eye, and then the eye got inside. And when I spoke with this child, he said, I want you to accept me as I am. The eye say that. I want you to accept me as I am. I want you to be soft with me. I want you to be patient. His father, I told him, how do you feel about this? You need to accept this is the situation. You're not accepting. You want change it, fix the child. No, it won't happen. First, accept it. So the mother said, yes, okay, I understand. The father said, yes, I will accept it, but only for 2 months, because in 2 months, this child is starting school, and I can't let him go like that to school. So I said, well, the father said, like, no, I don't have time. So I felt like this. I felt if I'm the child, I feel like this. All contract and like this. That's how I felt in front of the father. So, of course, it didn't help. I believe that if the father, because I gave him all kinds of things to do, baits, and I worked with the parents and I worked with him. We did everything right. It didn't change. It changed a little bit, but they weren't patient enough. And if the father said, no, we need to have change now, there won't be change. Because it's like the child said, no, I want you to accept me as I am. Can you open your heart to me as I am, not as you want me to be? Now I want you to open your heart to me. And the father said, no, I can't.
So, and I think what you said earlier about the mom who had the same, or the father who had the same experience, I think, like coming back to what we said in the beginning, or the inner child, or what you told me to do. So I think if you had any of those things, if you struggle with any of these things, what do you recommend for everybody to go watch the other episode with you where you did the listening to the eyes and kind of see if you're an adult, right? We're all adults now watching here. So going back to that and kind of seeing what happened, because a lot of times we repeat things that our parents did to us unconsciously, right? Maybe that dad, but the dad of that father was the same way and expected him to be perfect and do all these things, and he didn't have to, you know. So maybe that's, yeah. So would that be something that everybody could do? I want you to give us a few more action steps at the end. So to wrap this all up, to like what we give us some of the high level things that people can do, and then I think everybody should watch the other episode for sure. We will link that in underneath. Yeah.
So if you have a child with some vision problem and you don't know why, so you can ask for clues. And the clues can be in many places. So look for relationship in the family. Look for what do you feel about it. It's a very big clue. If you feel afraid, or if you feel anger, or if you feel sadness, if you feel that you are drifting away, like, and usually what the child is asking you is to be the opposite of what you feel. So if you feel fear, your child is asking you to trust. If you feel sad, your child is asking for you to be happy and to let's enjoy what we have and to accept it. If you feel detached, your child is asking for you to get more close, to open your heart. This is very big clue. And if this the vision thing is changing, check when it's changing, when there is the cross-side is more and when it's less. For example, at grandmother, you don't have anything, but in our home it does, or the opposite. And very important thing is to accept what is. First, you need to accept the situation. It's not that bad. Just accept it. And if your child will forever will be like this, so what? It's not the end of the world. Love him anyway. And from this point, you can help him improve.
I think that is just a beautiful way to come to a close. We are a little over time, but this was so fascinating. And we got another comment about somebody struggling with lazy eye. And so I think going back to, like, you know, as an adult, we can't really change that anymore. But if we are parents or grandparents, you gave us so many helpful hints. And a lot of it is really about looking at ourselves and being what we're feeling, tuning into what we're feeling about our child, and maybe even about our partner. And this is really applying to many relationships, I think, and especially to ourselves. And maybe doing the listening to the eyes for yourself. So watch that other episode, but also where can people find you? I know you have most of it is not in English, but I think we put a link in there where you can find things in English and connect with you. And right, and yes, your book is.
I have. Yeah, maybe I will put it later on the YouTube channel.
Okay.
I will put. You can join us to the newsletter mailing list. So I do write from time to time about things that happen. And I think that we're going to have more and more things in English. Also, my book will be published soon. And maybe I will open a training course for teachers.
I would love that. I'm going to be in. I'm going to definitely participate. And this is I've learned so much from you, and it's just fascinating. And this is the thing that, you know, most people, you know, we in that Western society, we want the quick fix. We want what the doctor said. We want the thing. And really, a lot of pretty much the root cause of so much is like the emotional things, that it's the harder work. And that's why so many people just wear glasses or do surgeries, because they're not willing to, first of all, knowing about it is one thing, but then also being willing to do the work, right? So anyway, thank you so much. We will have a little bit extra private time in my Clear Vision Club community. Thank you so much for being here. Goodbye, YouTube. And make sure we will link the other episodes so that you can review that too. Bye-bye.